Hello, I am Dr. Anusha Reddy, Obstetrician and Gynecologist, Laparoscopic Surgeon, Infertility Specialist at Medicover Woman Child Hospitals, HITEC City, Hyderabad. Today I am going to talk about a very interesting topic, that is antenatal care. Antenatal care is the care which we give to the expected mother from the time of conception to the delivery. So, what is the aim of this antenatal care? So antenatal care is main objective of antenatal care is healthy mother and healthy baby. So the main object of antenatal care is to give complete care to the mother from the time of conception till delivery. So we can identify the high risk pregnancies as early as possible, and we like to give the complete care to the mother, and we always advise both the couple regarding the mode of delivery and what are the physiological changes that is expected in the pregnancy. During pregnancy, what are the expected changes that we explain to the both couple, and we explain about the nutrition and the care and the need of exercises, and the complete care will be given to you. So I would like to divide this whole antenatal care into 3 topics. That is, usually the pregnancy is from the time of conception to the 40 weeks. So I would like to divide into first trimester, second trimester and third trimester. So first trimester is nothing but from the time of conception to the 13 weeks of pregnancy. From the 13 weeks to 28 weeks we call it as second trimester, and from 28 weeks to the 40 weeks we call it as third trimester. So first I would like to speak to you regarding first trimester care. So many of you have many doubts about the first trimester, when to come. As soon as pregnancy is confirmed, should we need to come, or we need to come after 3 weeks? What I would like to suggest you is as early as possible, immediately after your conception, immediately when you check your pregnancy test at home, please come and visit your gynecologist. So as early as possible, if you come, and we can detect many anomalies or many problems, whatever risk factors is there, we can identify early, so that we can prevent many issues, and we can even identify what are the chronic problems you are facing also. So as early as possible, you please visit your gynecologist. So we advise you to undergo few tests. First, confirmation of pregnancy. So how do we confirm the pregnancy? By doing a serum beta hCG or blood test, we can confirm your pregnancy, and we will ask you to go for an ultrasound. Ultrasound will see whether the pregnancy is intrauterine or it is there somewhere else. So that is called as ectopic pregnancy. So to rule out ectopic pregnancy, it's better always come as early as possible, so that we give you the best care. So once you come to us, we'll first assess you completely and we'll take thorough history, so that any problems, chronic problems which you are facing, we can identify, treat as early as possible. So once you come to the hospital, we give you the advice, and we give some multivitamins and folic acid supplementation to help your baby to grow. And as well as if you have chronic thyroid, and if there is any requirement of change of medications, we advise to change the medications, or if you are a hypertensive or any change of medication, because some medications might cause some problem to the fetus. So we always tell that to avoid few medications, or to switch over the few medications to harmless medications, so that the baby won't be affected. So first trimester, always remember, try to avoid traveling, and nutritious food and easily digestible. It's better to have easily digestible food, because of hormonal changes you will have some amount of gastritis and some amount of irritable bowel. That means you might have loose motions, or you might have some issues can be there, so that you should have some healthy diet which is easily digestible. So first trimester, as much as possible, try to avoid vigorous exercises, and you can have regular exercise. You can go for walk, but not vigorous exercises. And always folic acid supplementation should be taken, and multivitamin supplementation should be taken. And once in the first trimester, after main thing is that you have to come for the checkups monthly basis. Usually we for up to 28 weeks. Up to 28 weeks you can come every monthly. From 28 to 37 weeks you have to come every 2 weeks once, and from 36 week onwards you have to come every weekly. Now I would like to speak about second trimester care, that is from 13 weeks onwards, from up to 28 weeks of pregnancy. So what are the precautions to be taken and what are the medications to be taken, I'll explain you. So in this period, the maximum organogenesis happens in this period. So what I suggest you is that without consulting any gynecologist or your obstetrician, please don't take any self-medications. And this trimester usually we give iron supplementation and calcium supplementation for you, and even prophylactic doses like prophylactic vaccinations like flu vaccine and TT vaccine, tetanus toxoid vaccine has to be given in this trimester. And main importantly, as your doctor advised, there is a growth anomalies scan has to be done, and that anomaly scan will detect any anomalies is there for your baby. And one important thing I would like to say is that this time this is very important to start your antenatal exercises. So what is antenatal exercises? The exercises which keeps your pelvic floor muscle relaxed, so that you will have a normal and safe delivery, normal delivery. For that you need to start doing your exercises from second trimester onwards. Those exercises will explain you how to do, and some patients should not do these exercises, like if in case of hypertension, severe hypertension or polyhydramnios, or if the placenta is in the lower segment, then we always suggest to not to do exercises, but regularly every woman, every antenatal woman can do these exercises. So here also proper sleep is required, and this is the time like you need to take rest at least 8 hours in the night and at least 1 to 2 hours in the afternoon. And as advised by the doctor, you need to take the medications, and you have to come for the regular checkups. That is every monthly you have to come for the checkup. And then coming to the third trimester. Third trimester, it starts from 28 weeks onwards and it ends till 40 weeks. So till your delivery. So this is the time your baby grows to maximum. So the growth will take peak. Growth will start increasing. This is the time the growth goes increases more. So the nutrition is very, very important. We suggest you to take more of protein diet in this time and take lot of fluids, and always you need to observe your movements. So once you observe your movements, and if there is no any issue, then you have to come for the regular checkups as I suggested, and the frequency of checkups will be increased now. So every 2 weeks you need to come till 36 weeks. Then onwards you have to come every weekly. So our motto is to have a safe baby and safe mother. So we have to work together to have a normal delivery, and it depends upon the presentation, and it depends upon the position of the baby, and it depends upon the condition of the mother. So we explain you the mode of delivery as well, and we have a complete care here. We have a nutritionist in our Medicover hospital, so they will explain you what diet has to be done and what are the exercises you need to do to have a good healthy outcome. And we'll explain you, since you are giving birth to your child, so we prepare you mentally, physically to how to hold the baby and how to give the breastfeeding, so that in the pregnancy itself you will prepare your mind, so that you will have there won't be any confusion to how to handle the baby. So this is the complete antenatal care which we give to you as mother, and we hope for the we hope for the best outcome. So I would like to I would like to tell everybody that antenatal care is very, very important, and you should have regular visits as doctor informed, and never neglect your diet and your physical exercises, which will help you to have a good, healthy delivery. When you are prepared for the delivery, so the mode of delivery usually will be decided by us. Maximum will try to give normal delivery, but sometimes due to various conditions, like if you have some other high risk factors or the presentation is not a cephalic presentation, then we might need to go for cesarean section. Otherwise, we'll give you absolutely normal delivery. And many of you might have doubts that how should we go through the pains for long, and all these doubts you might have. And main I would like to say is that our Medicover is giving absolutely free painless labor, so that you can select for epidural analgesia, which will completely relieve your pain, and that will be counseled by anesthetist. They will tell you how it will be given. So usually it will be given epidural anesthesia by the anesthetist. So they will advise you how to take it and when to take and all. We will tell you, so that you will have complete pain relief, and so that you don't need to go for all these you don't need to face all this pain throughout the labor. So labor pregnancy, it might take 12 to 24 hours also. You should have the strength both physically, mentally, to have a normal delivery. So we motivate you completely to have a normal delivery, but you, from your side also, you should have that motivation to have a normal delivery. Thank you.